persons living with disability and older people in Tanzania and Indonesia. It's been a project that we have really enjoyed working on together with HelpAge Tanzania and Pusat Rehabilitasi YAKKUM Indonesia over the last year and a bit. The project has been funded by UNOPS with USAID background funding and is part of a set of projects that are working to build country capacity on, towards universal assistive technology with technical support from AT Scale, which is the technical assistance body that is working towards achieving AT 2030 strategy, enabling everyone that needs assistive technology to be able to access it. So this is just one project with 2 countries out of this larger set of projects that we're working together, but we hope that this will be interesting for all of you today. I think my slides are being shared. It's a little hard for me to see everything at the same time. Here we go. So this webinar has AI translation in about 65 languages. There's a couple of things that you need to know about that. First, we will have some people speaking in other languages, so you need to select a language. If you're using the Zoom app, you can just enable it. It'll be in your top corner or down where the chat box is, and then you'll be able to select your language that you'd like to receive the captions in. If not, you can use the QR code here. And if you'd prefer to read the captions, you can open a separate browser, or you can open it on your phone, for example, and listen to the captions in another language while you mute the original audio. So those are the options, and we'll share this as well in the chat so that you can access it after. Great. Can I have the next slide? Yeah. Okay, so today's agenda is rather full, but I think it'll be quite interesting. We'll have welcoming remarks from Ria Tariq in a moment. She is the Director of Global Impact for HelpAge International. And then following that, 2 of our technical advisor colleagues, Camilla Williamson and Diane Hiscock, will present a bit about AT linkages with universal health coverage and AT in humanitarian contexts. And then we'll hear from our partners, HelpAge Tanzania and Pusat Rehabilitasi YAKKUM, as well as a number of other actors in Tanzania and Indonesia. So I think that will be a good set of presenters to hear about what has been going on in the program and what people are, the progress that's been made across it. And then we'll have time for Q&A and can direct you to either of those teams or whoever. And we'll have closing remarks from Satish Mishra from AT Scale. I thought I would just say hello from HelpAge International. This project is multi-country and HelpAge International has been holding it. We are a global network, the Secretariat of a global network of over 170 organizations in 91 countries who promote the right of all older people to lead dignified, healthy, and secure lives. And so we work with partners and working on influencing things outside of just directly work on older people, but things that affect older people like universal health coverage to ensure that older people's rights and needs are being included. And it has been a wonderful example in this project to work together with these partners on assistive technology, which is one aspect of that. I've already shared the first 2 bullet points here, but I'll say that the main aim of this project, which was really, this project, as I was saying, is part of building a pipeline of countries that are developing AT capacity, AT scale initiative. And as part of that, the design of the project or the scope was kind of given by AT Scale in the project design phase. And partners then developed different bids based off of that. So it was interesting to see what HelpAge Tanzania and Pusat Rehabilitasi YAKKUM both brought to us, which was that although the aim of this is building national universal AT access, they both felt that there was a need for there to be some local district level work to feed into the national level advocacy and policy development work. So both of these projects have had those twin components. Both of the countries have used those twin components. And then we've used the regional and global engagements that HelpAge International has in UHC and long-term care and support and assistive technology in humanitarian settings and other low and middle income countries as well. to leverage what we've been learning and sharing across. That part of the project that you'll see in these presentations from Tanzania and Indonesia has really been about policy change. So there's been national level work done. I'll show you that on the next slide. And then improving data and evidence on AT services using some of the tools that have been developed by the WHO and AT Scale, and increasing capacity, technical capacity on AT as well. In this project over the last year, it's really quite a short time frame, and I'm very impressed with what HelpAge Tanzania and Pusat Rehabilitasi YAKKUM have accomplished together with the stakeholders. I think it speaks to the relationships that they already had in place, and then their capacity to leverage that for developing multi-stakeholder coordination mechanisms. In Indonesia, that was about working alongside kind of a rejuvenated National Disability Commission, and in Tanzania, developing a technical working group. And then this policy strategy work that's been going on in Tanzania has developed an AT strategy and an AT capacity assessment. In Indonesia, it's been a roadmap for assistive technology for Central Java. And then I think what's been interesting in that project is that there was already kind of a government-approved approach for AT service delivery and one in Yogyakarta. And they were testing to see would that work in another place. And out of that have developed maybe a more robust, continuous AT service and system in Purworejo district, and been able to develop this roadmap for expanding that out and across. Okay, next slide. I mentioned this a little bit already, but there are these engagements that HelpAge International colleagues have had, basically mainstreaming AT into other dialogues, even recently at the WHO Southeast Asia Regional Office. Southeast Asia region, they're developing a regional framework on healthy aging and really bringing in AT to that strategy, and working across the WHO Clinical Consortium and Global Network of Long-Term Care Experts to be bringing AT into those and sharing what we're learning in Tanzania and Indonesia and other countries. So it's been a really interesting project. I'm sure you'll enjoy hearing more. And I'll hand over to Ria Tariq to give some welcoming comments.
Thanks, Caitlin. Good morning, good afternoon, everyone. I'll try and not come in between the distinguished panelists because I'm sure all of us are looking forward to hear the insights. But it's really a pleasure to welcome you all to this important event. And I just wanted to say that HelpAge International has been at the forefront of advocating for better access to assistive technology in different parts of the world. And while we are witnessing a rapid rise in the demand for assistive technology, whether it's due to the aging population or the surge in non-communicable diseases, despite all of that urgent need and the profound impact that assistive technology can offer, nearly 1 billion people are still denied access to these crucial tools that can be life-changing. And we all know the disparity is especially pronounced in low-income countries where only 10% of people have the AT they need compared to the 90% living in the high-income countries. And despite all of these figures, promoting access to assistive technology still remains, unfortunately, a low priority for some governments, donors, and stakeholders. And we see it especially when we talk about older people. And that is why at HelpAge, as Caitlin was saying, we have been committed for a long time, and we have been championing for a long time for a better access to AT. And it can really change the experience of older people in their later lives, ensure that they have the dignity and independence they need. We have been working in over 20 countries now for the last 15 years, including Tanzania, Indonesia, Ukraine, and Bangladesh, and doing different things, whether it's been technical support, policy influencing, raising awareness and demand for AT. But again, I think the panel itself tells us that we haven't been alone in this journey, and really grateful for the leadership and vision of AT Scale, USAID, UNOPS, and the governments of Indonesia and Tanzania. And again, it's been an honor to collaborate with our partners, HelpAge International, HelpAge Tanzania, and YAKKUM, and of course, WHO, who have been providing their technical advice and tools, not just in this initiative, but we have been using that in different HelpAge programs across the world. I think we all recognize that assistive technology can really change the life and can have the positive impact on independence and resilience of older men and women. And it's much more than just looking at the demand and supply. And I think the fundamental aspect that this project has been looking at is about the policy and the enabling systems environment. So let's listen to what we can learn from Indonesia and Tanzania and how we can take this experience to other parts of the world. But huge thank you for all of you for being here. And I really look forward to the discussions ahead. Thank you, and back to you, Caitlin.
Thank you, Ria. Great. Well, I'd like to welcome Camilla Williamson next to share with us about integration of AT in universal health coverage. Over to you.
Thank you so much, Caitlin. And very good to be with you all today. I think it's not quite in full screen mode, but if you can, that's great. We can go to the first slide, please. So I wanted to just give a brief overview of assistive technology, healthy aging, and functional ability, and how that fits into universal health coverage too, and our work at HelpAge. So by 2030, 1.4 billion people will be age 60 and over. But while we're seeing increases in life expectancy, healthy life expectancy, so the amount of time that people can expect to live in good health, has increased by just over 5 years. So it's not keeping pace with life expectancy. And at the same time, we know many older people, an estimated 142 million older people globally, are unable to meet their basic needs. So we really need urgent action to reorientate societies, systems and services and communities to effectively promote healthy aging across the life course. Next slide, please. So the healthy aging, if you just click a couple of times, I think there's some parts that aren't showing yet. Healthy aging, we very much adopt WHO's definition, which is healthy aging is the process of developing and maintaining the functional ability that enables well-being in older age. And critically, that's not about the absence of disease or disability. It's about maximizing everyone's ability to continue to do the things that matter to them and matter to us all as we age. Whether that's meeting basic needs to growing, being mobile, building and maintaining relationships, and continuing to contribute and participate. Next slide, please. And it's very much, healthy aging is absolutely central to promoting people's dignity, well-being, and rights. So just one more click. Sorry, it's my fault with the slides. Our ability to be and do what matters to us in our older age is influenced by what WHO calls functional ability, and that's made up of our physical and mental abilities, the environments in which we live, and how those two things interact. And the next slide. And in terms of the environment and what influences healthy aging, there's a wide range of individual factors, but also critically the environments in which people live. So that's everything from housing and social facilities and transport to broader things like attitudes, income security, available services and support, but also the wider social, political, economic, cultural and legal and physical contexts in which we live. And access to assistive technologies is a really key part of that. Next slide. So we very much understand that AT crosses across many areas that we work in, and that it's essential for multiple sectors. So it comes from everything from a rights-based approach and embedding AT and access to AT within strong rights frameworks, including the right to health, as well as being a critical component of enabling environments, inclusive social protection, and universal health coverage. And that really, if you're able to ensure that access to AT is supported in all these different sectors and domains, then you can really help support older people to enjoy the healthy aging that we were talking about. Next slide, please. So HelpAge, one of the areas that we're focused on, particularly from the health and care side, is universal health coverage and people's right to the highest attainable standard of physical and mental health. And this includes the right to services, goods, and facilities being available, accessible, acceptable, and of good quality, and people being able to access them without discrimination of any kind. And the continuum of UHC essential services absolutely includes access to AT, it includes rehabilitation, but also at HelpAge, we very much emphasize that it also should include and people have a right to care and support as part of that broad continuum of UHC services. And assistive technologies are included as an essential health product in regard to UHC as well. So this is very much the foundations of our framework at HelpAge, which we call Achieving UHC Fit for an Aging World. And it's really about promoting age and disability inclusive and gender responsive health and care services that deliver equitable, integrated and person-centered services founded upon strong primary healthcare approaches, promoting healthy aging for all. And we can include information in the follow-up email to that framework. But AT is very much embedded within that as part of our advocacy around UHC Fit for an Aging World. And the way that we do that in the next slide, and the way that we're promoting that is with partners, is really by just the previous one previous. The supporting older people's voice and supporting their empowerment and engagement in decision-making processes and health services at different levels, supporting strong civil society and pushing for institutional change and social change, thinking about things like addressing ageism and ableism and also broader system barriers. And at HelpAge, we act as supporter, convener, and thought leader in that work. And last slide, we very much base our work on the individual older person and what is important to them, and recognize that the biggest change that in older people's lives will happen at the local and community level. And so we really try to focus on that while supporting that broader rights and entitlement systems and services, architecture, the social determinants of health, and addressing harmful norms and attitudes and promoting positive ones for healthy aging. So I'll stop there and pass over, I think, to Diana is coming next, but thanks very much.
Thank you. Yeah, so we're going to hand over to Diana Hiscock, who is our Humanitarian Inclusion Advisor, to speak a bit about assistive technology in humanitarian settings. Welcome.
Thank you. Thank you, Caitlin. So thank you very much. Just very briefly, really, to add into this very diverse conversation, from this project, the links in both Indonesia and in Tanzania, where they have a lot of conflict and climate change related issues, which highlight also the importance of assistive technology in humanitarian settings. Next slide, please. So I just wanted to reinforce the importance of this project and all the AT scale portfolio projects here on where the need for AT needs to be better recognised in humanitarian settings. And especially in the areas we've had this project, we see increased conflicts, and we know not only in Tanzania and Indonesia, but the whole world has experienced more conflicts. We see them more entrenched, longer lasting, and devastating consequences on civilians. And therefore, the AT flag rises very high in this discussion. And likewise, as we see in Indonesia and Tanzania and many other countries, the climate crisis is spiraling. We're leaving a trail of destruction in its path, and therefore people's lives are completely changed, and the consequences on their health and care is impacted on, and access to AT likewise. And then we're also challenged, not only in the humanitarian, but across the world, on the economic dynamics are overlapping with conflict, climate disaster, infectious disease outbreaks and others, and which are bringing significant drivers of humanitarian need. And I think from our constant reflection on data, we hear the figure that 1 in 73 of the world are forcibly displaced, a ratio that's doubled in the last 10 years. And consequently, when linking with the issues of AT, that obviously impacts on the increased level of need. So it is a critical area to consider more in depth. Next slide, please. And just to reinforce, basically, we recognise clearly in both any humanitarian setting, the emergency situation creates huge strains on the healthcare and social services, and the systems are often collapsing. And that's why our work is very important to reinvigorate the systems and try and bring in these support services, especially with the AT levels. We know that many affected people of all ages, with and without disability, in these settings have limited access or no access to AT. And we also are not collecting relevant data systematically. So there we bring some challenges to the table, which have been addressed and looked at in this project. We do also see in the context of war, there's more attention given to trauma care, obviously to save lives, than to rehabilitation and assistive technology services. But we're seeing that is being challenged, and there are changes in recent years, which are wonderful to see. And likewise, in natural disasters, there's limited attention given to rehabilitation and assistive technology services systematically in a response. And this is something we're trying also to advocate more and to actually design more projects on this. But I think what is often forgotten, and we see this quite a lot in research, is that in a humanitarian crisis, people may have had an assistive device or product before. They may have lost it. They may have a new injury or an impairment. They may need another one. And so it's a very complex issue, which makes the humanitarian setting really need to understand better the ways forward. So I just want to flag two really good practices that I think we've all learned from a lot this year, and that is the WHO work in Ukraine. And it was a rapid access to essential assistive technology for IDPs in Ukraine. And it was very interesting work where I think the takeaway is that the work on assistive technology is integrated into the emergency response, not as a separate entity. And with that came an incredibly useful series of trainings to service providers on the 8010 products that were provided through this and on the TAP program. And this has been really useful learning. And I hope that we can learn more from this and take that forward in future humanitarian settings. And then the next slide, please. The tools I think have really come out in this year, which are building on other work from before, is the TAP capacity strengthening initiatives on assistive projects in emergency. Super interesting, super useful, and we've really benefited from that work. And likewise, the wheelchairs in emergency learning, which has really been very practical. And that's where we see things are really moving ahead, and we're having much more concrete ways to improve our humanitarian system. And the last slide. And just to reflect from this project, and I really appreciated having the opportunity to work with the colleagues on this, is how important it is that we consider culture and context, because that really has made a difference to how we work together to make sure we have an effective impact. And one size doesn't fit all. And that's the challenge with maybe older models of working on AT. And we've seen very much in this project that without the good data collection, we are missing a lot of really useful information. So this is the issue of data and the type of data we collect. Again, we need to improve that from our lens, as many others. And one key learning, as Caitlin alluded in the beginning, is the really strong relationships we've had with the national governments and the multi-stakeholder approach to be able to embed AT in emergency planning and in other planning. But this is something we can take forward in the future. So a really strong learning point from our lens here. And so I think sharing the learning globally is so important to make sure that we really push the agenda of embedding AT into humanitarian action in the future as a key essential need for people in their preparedness response and recovery. So really to applaud this project's learning and taking things forward. So thank you very much for that. Okay, over to my colleagues. Thank you.
Thank you, Diana. Okay, so I think that first intro, so first of all, for anyone who's joined us, we'll post again the link for the AI translation. It's called Wordly. And if you're using Zoom, you can access that in your Zoom app. But if you're using it with your browser, you can use the QR code and either listen on your phone like a separate device, or you can read captions in a separate browser. So someone will paste that in the chat again in case you've just joined us. But the first opening comments and presentations have really shown why the issue of AT, universal AT, is so important, and why it's so important to those of us that are working on ensuring that all older people can live dignified, secure, healthy lives. So I am now going to welcome our colleagues from Tanzania to share in-country reflections and learnings. There is a video with older people representatives that is 16 minutes. So we will paste the link, I think, in the chat for that one. I think that's right. And then I will be welcoming first Leonard Ndamgoba, who is our head of programs for HelpAge Tanzania. And he'll give a 15-minute presentation on the project and what they've been doing and learning. And then we're very grateful to have with us Rashid Mafta, who is the Director for Persons with Disability from the Prime Minister's Office, Labor, Youth, Employment, and Persons with Disability, and Dr. Mwini Kondo from Amir, Assistant Director of Rehabilitation and Geriatrics, the Director of Curative Services from the Ministry of Health. So they'll be able to give direct comments from the government, who I understand has now received additional funding to invest in AT, and really looking forward to hearing from them as well. So over to you first, Leonard.
Thank you so much, Kathleen. Martha will do the presentation and I will come in.
That's great. Thank you. Martha, you're very welcome.
Okay. Hello, everyone. My name is Martha Jerome from HelpAge Tanzania. I work as a health and care program monitoring, and I was the one who was coordinating this project in Tanzania. Rosalind, can you please share the, okay, thank you. So I will be presenting on the project titled Improving the Systems and Policy Environment to Strengthen Access to Assistive Technologies in Tanzania. Next slide, please. This is the outline of my presentation. We'll cover on the background, project goal and the results. We'll look at the achievements, challenges encountered, and then lessons learned. Next slide, please. So looking at the background, the prevalence of disability in Tanzania, that we have 9.3% of the people who are aged from 7 years and beyond. These are the ones who are having disability. And looking at the general population of 60 million people, it's about 6 million people now who are having disabilities. And with us, disability, as in all over the world, is increasing with the age. 2 out of 3 older people in Tanzania will need an assistive technology. And there is a high level, the previous situation before implementing this project, we saw there was a high level of uncoordinated and fragmented AT provision. And most oftentimes the provision of AT was on ad hoc manner, maybe provided through charities or people procuring on a personal basis. But also we are still we're experiencing difficulties in accessing AT. According to the country capacity assessment we did through this project, we found that about 1/3, that is 2% of AT users indicated the inability to access AT. And also there is still low awareness on AT among the people with disabilities and their respective communities, those who are the caregivers and the rest. And also persons with disability, or people with disability are experiencing the high level of poverty, making it difficult to afford purchasing the AT. And also there are prevailing high levels of stigma and discrimination in the communities. These are limiting AT access and use among the people with disability. Next slide. Next slide. Yeah, the goal of our intention, we're implementing this project at national level as well as the district level. And the goal of this project was to contribute to the preparation of the national policy on assistive technology to guide improved accessibility to appropriate AT by people living with disability of all ages. And we had 3 results. Then result number 1, this was focusing on improved government capacity. And result 2 was focusing on improved capacity and management of AT provisions to address the identified gaps. And the third one was on improving the capacity, coordination, and collaboration of AT among key stakeholders, including the primary healthcare workers, community-based organization, and older people and people living with a disability. Next slide. So our intention at national level was to support the development of a national policy roadmap on AT with a technical working group on AT with a multi-sectoral stakeholders engagement, including people living with disability and older people in this manner. And also at the district level, we were looking at conducting data collection, training of health staff, and coordination and engagement of stakeholders in 2 councils. This is in Korogwe district in Tanga region. Korogwe, we have rural and town councils. Next slide. So our achievement, number 1, looking at the result, number 1, we established a functional multi-sectoral stakeholder with members from the key ministries, that the Ministry of Health, Ministry of Prime Minister's Office, Labor, Youth and Employment and People with Disability, and also Ministry of Community Development, Gender, Children and Special Groups, the Prime Minister's Office, Regional and Local Government Authority, which is a ministry mainly focusing on providing services. And also we had UN agencies that was like WHO, UN Women, and we had ADD International, and the local CSOs such as CCBRT, AfriWorld, and Shiviata, which is an umbrella organization for people living with disabilities. And also we had the National Older People Forum. And throughout the project implementation period, we managed to hold 3 meetings. And we found that the multi-sectoral working group played a crucial role in guiding and coordinating actions and system for the project, including the country capacity assessment and the development of the national assistive technology strategy. It was like providing leadership and guidance. Next slide, please. And another achievement is that we developed a standalone national assistive technology strategy. And this was the main, the focus that we have in this project. And we provided technical and financial support to the Ministry of Health, Ministry of Prime Minister's Office, Youth, Labor and Employment and People with Disability, which was a coordinating ministry, but it was working closely with the Ministry of Health and the consultant to draft the national AT policy. And in this manner, the ministry responsible for disability led the process due to its mandate in coordinating disability matters. And initially we thought Ministry of Health, but as we consulted the government, we found that this will be the responsible ministry to coordinate all issues related to disability. Next slide. Next slide. Yeah, as you can see on the right side, this is the outlook of our strategy. And this was a very consultative, the development of the strategy was very consultative. We got the inputs from different stakeholders, mainly the older people, people living with disabilities, CSO, WHO, HelpAge Tanzania, HelpAge International, and line ministries, as you can see. And also we did a consultative forum at the regional level, which is the lowest level of the implementation, that is the primary healthcare level. And we come to realize that as we have this document, it really provides a streamlined coordination framework for AT from the village to the national level. And the strategy basically is having 6 focus strategic areas, focusing on the 5 Ps that is provided by WHO, incorporating other areas like monitoring and evaluation and the overall coordination and monitoring framework. And you can see the link where you can find the document in detail. Next slide. And also, we immediately after having the document, HelpAge in the ministry responsible for disability facilitated the endorsement of the document by the principal secretary with a high-level commitment we saw by the disability section, because they tirelessly work within a very short period of time. We managed to have the document completed and signed off. And after signing off, before signing off, we also we did the dissemination meeting for the document. We're gathering 60 participants, including from 9 ministries, CSO, older people, people with disability, and other UN agencies. What we found out in this process during the dissemination of the document is that we managed to have a more stronger national cross-sectoral technical working group on AT, because we gathered a lot of more stakeholders, the CSO, disability-related organizations, and we had like 45 participation of civil society organization. And this is what will take over throughout the monitoring, the implementation of the strategy. And also through this meeting, we drew our sustainability plan and they discussed on how we can continue pushing and the government to continuously address shortcomings identified by the CSO and the cross-sectoral working group as we implement the National Assistive Technology Strategy. Next slide, please. Yeah, this is a photo of the consultative forum we had at the regional level. You can see the wide array of people with disability as well as older people in Korogwe. Yeah, next slide. Yeah, and another achievement is that we supported the assistive technology country capacity assessment, and the country assessment, the country capacity assessment exercise was very consultative. We can say is that it incorporated or it included various stakeholders from the collection of the data, and we used the WHO AT assessment instruction manual, and the consultant was highly guided by the WHO, HelpAge International, Ministry of Health, and the ministry responsible for disability throughout the process. And the final assessment report was reviewed by a multi-sectoral working group, and they gave their comments, and the document was improved based on the input. And we find this document very useful in the manner that it will inform the development of the National Assistive Technology Strategy. And also we will continue using it to raise awareness and continuously monitoring the National Assistive Technology Strategy, because it provides a basis, the baseline on what the situation was before implementing the NATS. And also, this is also the knowledge capital in terms of that strength to finance, regulate, and procure and avail AT. And we also found that it provides a robust foundation for future AT initiatives. Next slide. So this is the outlook of the country capacity assessment report, and we have provided the link. Next slide. Yeah, we also managed to reach the hard-to-reach people living with disability, and as we were implementing this project at the district level, and we trained 40 community-based health workers who we collaborated with a local CSO AfriWork in implementing this project. And these community health workers, they are providing education and information to the community, as well as identifying people with disability in the communities. And we managed to reach to 1,284 people living with disability. And among these, we identified three, these were the overall community that was reached, but also we identified 344 people living with disability in need of AT in Korogwe. And they see the community health workers managed to refer 158, and they enabled 50 out of these to acquire assistive technology. Next slide, please. So these are some of the people living with disability who were receiving the assistive technology. Next slide. Yes, under Result 2, we managed to build the capacity of 30 representatives from health and social welfare departments in Korogwe district on disability and the AT services for improved management of assistive technology. And here we did a training to 44 participants who are from the Council Health Management team, in charges of the health facility from 2 hospitals, 5 health centers, and 23 dispensaries in Korogwe District Council, and also with the presence of people living with disability and older people. And this training strengthened the participant knowledge on AT assessment, fitting and use, and the basic support for people who are using AT, and the training on the use of AT, maintenance, repair, and the advocacy for assistive devices. And this training, we found that it increased the realization of the integrating AT services among the people who are key in providing health services in the district, looking at the council health management team, which is responsible for overall supervision of the health provision in the district. And as we went along, the government has issued a circular directing the provision of assistive technologies in all the health facilities. And now they are looking rigorous engagement by the local council to explore all the available financial options to ensure that older people and people with disability have access to assistive technology. Next slide. Next slide. Yeah, and we managed to map out stakeholders who are implementing the project within the district, and these are the type of stakeholders. We had non-governmental organizations, government agencies, educational institutions, technology developers and manufacturers, healthcare institutions, and also the end users and caregivers for people living with a disability. Next slide. Next slide. Yeah, and we participated into the first ever World Day for Assistive Technology. We had a media advocacy. We conducted a media advocacy. And lastly, we managed to produce the documentary for awareness raising and sharing of our work on AT. Yeah, thank you for listening. This is the end of my presentation. Welcome for comments. Yeah, and now we have the lessons learned and challenges. 2, we engagement of community health workers. We found that it is crucial in reaching out to people with disability who are often hidden and into the houses. And through implementation of the project, the community health workers were able to uncover those people who didn't know even the existence of assistive technology. And also we found that, yes, and also the development of the multi-sectoral working group, where we found that was one of the very important mechanisms in shaping AT ecosystem and stewardship by bringing the stakeholders together in the project, that we are providing leadership, and we generated a lot of knowledge and information that we are guiding the entire process of AT National Assistive Technology Development Strategy, the strategy development. Next slide, please. Yeah, this is it. Thank you for listening.
Thank you, Martha. Okay, so that is, thank you, Martha, is summary of everything that was accomplished in this 1 year, and I'm really looking forward to seeing what comes next in Tanzania for AT. That this can have been part of laying the foundation for. I understand that we don't have our colleague from the Prime Minister's office online, but we do have Dr. Msafiri Kabulwan from Ministry of Health. So could I welcome you to share from your perspective from Government of Tanzania?
Hello, thank you. Safiri Kabura, the focal person for person with disability, but also for the other person, the Minister of Health Tanzania. I comment on the work that HelpAge Tanzania has been working along together with the HelpAge International, but also the support that we got from the units that enable this endeavor to be taken to take place in Tanzania, and specifically in the two mentioned the council of Korogwe Rural, but also the Korogwe Urban. And during this project, as Martha has presented, the big support that this also will be the milestone for the government. It was the formulation of the National Assistive Technology Strategy following the completion of the country assessment on the assistive technology. And this, if you are aware that Tanzania have a 5-year national rehabilitation strategic plan, and among the key areas within this strategic plan is the strengthening the ecosystem of the assistive technology. And this for us will be a good milestone because we were trying to find a way how we're going to formulate some strategies in the area of the assistive technology. And through this support, we appreciate the support. And since as Matt has presented that already the strategy has been signed by the permanent secretary, we are waiting for the signatures of the ministries from the Prime Minister office, but also the Minister for Health. Once the document has been signed, now it enter into the full implementation. But also, even before being signed, the government through the Minister of Health, for example, during the financial year of 2024 and 2025, has set aside some fund that will be used for buying assistive devices. For example, we have set fund for buying 500 white canes, but also some walking stick for other people, but also some axilla clutches for other people, but also for persons with disability. So what I can say on behalf of my colleague, Dr. Mwinyi, that the government is working on this area of the assistive technology, but also to make sure that the question is included for sustainability. We have also established some dialogue mechanism. In Tanzania, we work together with some partners, be it UN agency, the international organization, local and international NGOs, through dialogue structures. We have some technical working groups, and then we have devised a technical working group that will include the disability, but also through the disability, the agenda for the assistive technology will be brought on board. So we think that through this dialogue, and they're also working with various stakeholders, the agenda for the assistive technology as well as the disability will be included in the various strategies. And for those who are not aware, Tanzania, in collaboration with the WHO, we have formulated a 3-year guide for action on health equity for persons with disability. And we think that through this guide also, it will help the government in spearheading the agenda for inclusion of persons with disability, but also the area of the assistive technology. Back to you, Catherine. Thank you.
Thank you very much. Okay, I think we could probably go a bit further. Leonard, do you want to say just one thing? It's just that we're running a little bit late.
Sure, so I just wanted to add some best practices, because for me, I think these are very important for those who will be programming around this. And one of it was the way the project was structured. Having intervention at local level where you would collect practical things around challenges, opportunity, and use them to engage dialogue at the national level, for me, was one of the best practices. And probably that is why we have managed to succeed, because we had our project structured in such a way that we could have all the gist at the local level from the beneficiaries. That is one. But the second one was around the way we have engaged in coming up with the strategy and the assessment, trying to ensure in all our advocacy program, we are linking all the key frameworks, the universal health coverage, the Sustainable Development Goal, and the Convention on the Rights of People with Disabilities. Because for us to be able to attract all stakeholders who had the interest on people with disabilities, we had to ensure our framework was guided by the three frameworks, which for me, I think was very great. And looking at the final product, I mean, the strategy, you would see those are the frameworks which have shaped our strategy. And the last two was on having a multi-sector working group. You know, this one was like, in most of the countries, you will see the working group is involving government officials. But for us, ensuring that we are having the participation of civil society, who are working principally in our country at the community level, almost by 60% to provide assistive technology, to guide and coordinate, for me, was the best practices. But the last one was being able to at least put in place an exit plan where you could lay down steps to enhance the strategy implementation. Because at the end of the day, we have seen in many countries, we have many strategies in the strategies and what policies in the LOPs, they are not implemented. But for us, at least for this program, we had an opportunity to be able to develop an exit plan where we would ensure the implementation of the strategy. So those are the best practices which we have drawn from our project. Thank you, and back to you.
Thank you. Yeah, and I think that those four, I mean, I think we'll have that written up for you, Anil and Satish, because I think it's true in Indonesia as well, and probably would benefit a lot of countries. Okay, I'm looking forward to bringing us over to Indonesia now. We're starting with hearing directly from an older person, representative. Her name is Ibu Samira. So I think she's online with somebody else. And then after that, we'll have Aditya Setiawan, who is the head of Holistic Rehabilitation Center for Pusat Rehabilitasi YAKKUM, who will run through the project and what has been accomplished this year. And then we have with us Ahmad Jainuddin, who is the head of Social Population Control and Family Planning from the government of Indonesia, the head of Assistive Technology Working Group for the Purworejo district. And then at the national level, we have with us Jonah Dominique, who is the Commissioner for the National Disability Commission. I see your hand is up, Camilla.
Just to remind people, I think the older person will be speaking Bahasa, and so please do log into Wordly for translation.
That's right. Okay, great. So Aditya, we're starting with Ibu Samira, right?
Yeah, Ibu Samira is now with Johan Pakusa Dewa, so we can ask him to help Ibu Samira to state something
Excellent.
about the benefits of assistive technology in her life.
Thank you.
Halo, selamat malam.
Halo, selamat malam.
Iya, monggo Bu diperkenalkan. Mohon maaf, ini karena Ibu Samira bahasa Indonesianya kurang lancar, jadi untuk berbicara campur-campur bahasa Indonesia dengan bahasa Jawa atau bahasa daerah. Monggo Ibu.
Nama saya Bu Samira, umurnya 64, kerjaannya dagang di pasar, dagang bunga dan sayuran. Kemudian lama-lama kaki saya tertusuk beling, sudah dioperasi nggak sembuh-sembuh, sudah 2 kali, lalu diamputasi di rumah sakit. Kemudian saya mendapatkan bantuan kaki palsu lama sekali, 1 tahun, dari sembuh 1,5 tahun. Mendapat kaki palsu 1,5 tahun, dan itu sudah mendapatkan kemarin 3 tahun sudah rusak, belum mendapatkan lagi, belum 5 tahun. Alhamdulillah saya mendapatkan dari YAKKUM, sudah saya pakai, sudah nyaman.
Sesuai yang diinginkan buatan Mbak?
karena sesuai saya yang diinginkan sudah nyaman, sudah bekerja, bisa mendapat kerja lagi, sudah bisa stabilitas lagi di pasar, di rumah.
Berarti untuk alat bantu nyaman ya, Mbak?
Nyaman, alhamdulillah nyaman sekali.
Untuk harapan Mbak ke depan bagaimana, Mbak?
Kalau ada lama-kelamaan sudah berapa tahun sudah rusak ya, minta bantuan lagi.
Nah, terus untuk sebelum mendapatkan dari YAKKUM, itu sulit apa bagaimana prosesnya, Mbak?
Dari aku saya susah mencari kemana-mana, nggak ada. Kalau di Solo kan tunggu 5 tahun, belum 5 tahun belum dapat.
Begitu Mas Adit, ini karena sebelum mendapatkan bantuan dari YAKKUM untuk memproses mengakses alat bantu itu susah. Katanya menurut informasinya Mbak Samira itu baru bisa mengakses 5 tahun baru bisa mendapatkan bantuan lagi. Begitu Mbak?
Ya, 3 tahun belum, sudah rusak
Iya.
tapi
Karena alat bantu yang dipakai kemarin sudah dipakai 3 tahun itu rusak, tapi untuk akses alat bantunya lagi itu susah itu Mbak Nge.
Ya.
Itu dulu dari mana Mbak?
Dari
Oke, Pak Ahmad cekap.
Ya. Terima kasih.
Oke,
Mungkin Mbak Sam.
yeah, I can help to summarize the
Yeah,
key
thank you, because it
points.
looks like the wordly translation got messed up a little bit. It kept switching to like another language or something accidentally. So please, over to you, Aditi.
Yeah, okay. Thank you, Kathleen. So the one who just provide the testimonial is Ibu Samira. She is like the one of our project beneficiaries, the recipients of assistive technology from the assistive technology working group in Purworejo. She said that actually she was looking for the prosthetic legs for more than 3 years, but there isn't any scheme that could help her to get the prosthetic leg. However, it is because the project assistance and through the assistive technology working group in Purworejo, she is able to get the prosthetic leg that is comfortable and suitable with what her needs. Yeah, I think that's the summary, Catherine. Hope it is helpful.
Thank you. And thank you, Ibu Samira, for joining us today. Okay, over to you, Aditya, to share about the project.
Yeah, thank you, Kathleen. Is my presentation can be seen?
Yes, I can see it.
Yeah, so for tonight, I will share about what our work that is supported by HelpAge International and UNOPS in Purworejo. Actually, it is aims to strengthen the system and policy of assistive technology in Indonesia through the model development in Purworejo district. So in the initial phase of the project, we conduct the survey to the 415 people in Purworejo. And from the data, it is found that more than half of the people who supposed to use assistive technology, 58.5% of them do not use assistive technology because of many reasons. It is because like they could not get the access on assistive technology. They do not have any money to buy the assistive technology and so on. And from the people who already use the assistive technology, they even state that their assistive technology is not in proper condition or could not be used anymore. And from the people who already use assistive technology state that the majority of the assistive technology that they got is they got it from the government. And the majority of the people said as well that they could not access the assistive technology because of the unavailability of assistive technology. And as the background of this project, in Indonesia, the government already have several schemes on assistive technology provisions. It is like the Ministry of Health scheme. They could provide 7 types of assistive technology. The Social Ministry also have their own programs on providing the assistive technology. And even the village government actually can provide the assistive technology as well. However, those schemes are do not spread amongst the people. So that's why people do not know on how to access the assistive technology, how they should contact to get the assistive technology, and so on. And even in Purworejo district, when we have not conduct the project, there is no database on assistive technology that already provided to the community. And even like there are many cases found that some people who get the assistive technology already have more than one assistive technology in their home, even though the assistive technology is not spread to whole community, and some already have more than one. It is that we found in the initial phase of the project. And from that findings, actually we have closely connection and discussions with the government of Purworejo district, especially the social office Purworejo district, to conduct something, to develop something. And we finally managed to develop and establish the working group on the fulfillment of assistive technology for people with disabilities and elderly in Purworejo district. Actually, it is not only consisted from the social office only, but also consisted of social office, health office, village development office, as well as the civil society organizations and groups of people with disabilities and elderly groups in Purworejo, which have important roles in and their own responsibilities on the fulfillment of assistive technology. It is because we believe that everyone have rights on assistive technology, even like the people with disabilities and elderly people also have responsibilities to report whenever they know or their neighborhoods need assistive technology, for the example. And from that assistive technology working group, we also developed the scheme on assistive technology provision in Purworejo district. Actually, we have developed and tried 2 schemes. The first scheme that we developed is we gather everyone who needs AT in one place to facilitate the health checking, to facilitate the referral, as well as the making of assistive technology itself. So it will be easier and faster. But through that scheme, we learned that the needs of assistive technology is every day. It is not only in 1 or 2 times every year. So that's why we develop a further scheme on referral scheme from the primary healthcare to the public hospitals, and then to the provider of ATs in Purworejo or in the surrounding area. This is the picture of Ibu Samira, the one that already provide the statement before me. So she get the prosthetic leg as well as the crutch to help her to learn to walk with the prosthetic leg. And after we have developed the scheme, the assistive technology and the practices in Purworejo, we use these practices and the model that we have developed to advocate it to the further level in Central Java province. In that level, we advocate to develop the roadmap on AT fulfillment in province level, and it is also now being used and contribute to the inclusive healthcare roadmap in Central Java. It is because ATs is part of the healthcare mechanism in Indonesia, so we try to integrate it with the other roadmap that has been planned by the government. And we also using the practices in Purworejo to advocate it to the coordinating Ministry of Human Development and Culture to improve the cross-sector coordination at the national level. It is because we have been achieving the multi-sectoral coordination in the district level through the Assistive Technology Working Group, and has also being a decree from the head of Purworejo district on the Assistive Technology Working Group. So it have to be sustainable even after the project assistance finished. And this is the screenshots of the coordination meeting held by coordinating ministry in the national level. And on that meeting, all of the participants, the ministerials, as well as facilitated by the National Commission of Disability, agree that we need to develop the roadmap on AT fulfillment in national level. It is because what we have conducted and what we have do in Purworejo has inspired the government in the province and national level, and it can also answer the problems of AT fulfillment need to be done by the one stakeholder like social ministry only or health ministry only, but it could be covered through various schemes owned by the government and even the non-government who would like to support on the AT fulfillment. And this is the examples of several stakeholders that we involve in our work in local level. Of course, we always involve and directly coordinating with the district government, the organizations of people with disabilities, elderly organizations, as well as the government in the province level and some civil society organizations in the local level. And in the national level, together with the National Commission on Disability, which are also in this webinar as well, so he can provide further information on that. We conduct advocacy to the various ministry like Ministry of Health, Coordinating Ministry for Human Development, as well as the National Development Planning Agency and Ministry of Social Affairs. It is aimed to match the AT fulfillment in the existing work or existing documents that they already plan to develop. So it is not aiming to develop something new, but it is aimed to coordinating every ministry work to be united, to be coordinated, and can fulfilling each other. And through that work, through this project, we learned that cross-sectoral collaboration is a key on achieving the fulfillment of the right to assistive technology. And it is also important for the civil society organizations to take part on developing the system aligned with the government system, not to develop the system by ourselves. And of course, it is very important to ensure the involvement of people with disabilities as well as the elderly groups through the advocacies, through the planning, implementation, and monitoring as well. And lobbying and advocacy activities with relevant stakeholders is aligned with the project targets as well. I think that's all for me. It is because we still have some words from National Commissions of Disability, as well as the head of the coordinator of the Assistive Technology Working Group in Purworejo, so we can learn and hear further from them as well. Thank you, Catherine.
Thank you very much. Okay, yes. So as the DTS said, I'd like to pass over to Ahmad Janyuddin, who is the head of Social Population Control and Family Planning Office and was also the head of the Assistive Technology Working Group for Purworejo District. So please welcome and looking forward to hearing your thoughts on the work that happened in this project.
Silahkan Pak Ahmad mungkin bisa cerita dari perspektif Pak Ahmad tentang proyek ini dan bagaimana ke depannya, begitu.
Oke, terima kasih Miss Catherine dan Mas Aditya, juga teman-teman saya semua yang pada malam hari ini bisa ikut Zoom. Izin memperkenalkan diri, saya Ahmad Jainuddin, Kepala Dinas Sosial, Pengendalian Penduduk, dan Keluarga Berencana Kabupaten Purworejo. Merasa terhormat bisa bergabung di forum kemanusiaan lintas negara seperti ini. Tadi saya mencermati banyak belajar dari yang disampaikan oleh para presenter sebelumnya terkait dengan bagaimana kami harus melayani, memenuhi alat bantu kami penyandang disabilitas di Kabupaten Purworejo. Kami merasa sangat terbantu dengan support dari teman-teman YAKKUM, yang ternyata di belakang YAKKUM itu ada HelpAge, kemudian Assistive, juga UNOPS, yang kemarin selama kurang lebih 1 tahun bersama kami membangun satu sistem untuk menyelesaikan mengatasi persoalan-persoalan yang selama ini kami hadapi. Mengingat kami pemerintah menyadari bahwa dalam memenuhi alat bantu bagi penyandang disabilitas, kami harus mengelola anggaran yang tidak hanya terbatas jumlahnya, tapi juga mekanisme yang cukup panjang. Yang kami bisa berikan tahun ini misalnya adalah perencanaan yang kami sudah harus susun di tahun yang lalu, bahkan 2 tahun sebelumnya. Dan yang kami lakukan tahun-tahun sebelumnya, mengingat keterbatasan yang ada, kami lebih bergerak pada pemenuhan alat bantu yang standar. Yang tadi disampaikan oleh Mas Adit, bisa jadi satu penyandang disabilitas ini memiliki beberapa alat bantu yang tidak semuanya berfungsi dengan baik karena belum bersifat adaptif. Tapi dengan adanya mekanisme yang dibangun, yang kemudian terbentuk dalam lembaga yang namanya kelompok kerja, yang di sana terlibat tidak hanya dinas sosial, dinas kami, tapi juga melibatkan lintas dinas seperti tadi disebutkan Mas Adit, ada dinas kesehatan, kemudian ada dinas pemberdayaan masyarakat pedesaan, kemudian juga ada lembaga non pemerintah seperti komunitas lansia, kemudian organisasi-organisasi penyandang disabilitas tingkat kabupaten maupun yang dibentuk di hampir seluruh distrik atau kecamatan. Kemudian juga kami melibatkan perguruan tinggi. Ternyata kami menyadari kemudian mampu membangun satu sistem di mana bisa lebih luas mencakup teman-teman kami penyandang disabilitas yang notabene mereka adalah dari sebagian terbesarnya dari kalangan miskin yang gagap teknologi, yang tidak tahu harus kemana dia mencari bantuan untuk alat bantu mereka. Kami permudah sistemnya menjadi satu sistem yang terpadu, tentu berbasis yang dibantu oleh teman-teman YAKKUM menyelenggarakan survei gap. Ternyata jumlah disabilitas di Kabupaten Purworejo dengan jumlah yang sudah mempunyai alat bantu itu cukup besar. Maka atas dasar itu kami bangun satu sistem yang terpadu, mana masyarakat penyandang disabilitas ini menjadi lebih mudah untuk mengakses informasi, kemudian mendaftarkan dirinya. Kami kerjasama dengan Dinas Kesehatan sebelum kami menyampaikan pada para penyandang dana butuh alat disabilitas, alat bantu seperti apa, kami minta rekomendasi dari tenaga kesehatan, dari dokter-dokter spesialis. Inilah yang oleh Bang Jona, Komite Nasional Disabilitas Indonesia ini dikatakan bahwa sistem yang kami bangun ini tidak berdasarkan keinginan dari penyandang disabilitas, tapi merupakan kebutuhan karena sudah disesuaikan dengan rekomendasi dari tenaga-tenaga kesehatan. Ini yang sudah kami jalani selama 1 tahun ini dan manfaatnya seperti tadi Mbak Samirah yang memberikan testimoni sekarang mendapatkan alat bantu nyaman dipakai, memecah kebuntuan yang dulu 5 tahun tidak pernah mendapatkan alat yang nyaman. Ini semoga juga dialami oleh Mbah Samirah yang lain di Kabupaten Purworejo. Tantangan besar bagi kami memang setelah program ini kemarin selesai, kami berkomitmen supaya program ini bisa kami lanjutkan walaupun tidak mudah. Di bulan Agustus ini kami juga akan melaksanakan pelayanan alat bantu. Ada mitra yang bisa menjadi penyandang dana. Kami coba sodorkan sistem yang kami bangun. Tapi ternyata juga tidak bisa mengakomodir 100% seperti yang kemarin kami laksanakan dengan teman-teman YAKKUM dibantu oleh HelpAge, Assistive, dan UNOP. Namun kami tidak patah arang, insya Allah, bahwa peran, kontribusi, kemudian kepedulian yang sangat tinggi akan datang dari berbagai komunitas. Kami optimis tantangan-tantangan itu ke depan tentu pasti ada, tapi kami bisa melaluinya pelan-pelan sambil menumbuhkan kesadaran bersama di tingkat akar rumput masyarakat, penyandang disabilitas maupun para pemangku kepentingan. Termasuk harapan sistem regulasi yang ada yang sedang kami bangun dan kami usulkan sampai di tingkat kementerian adalah penguatan dana desa yang lebih konkret bagaimana mendukung alat bantu. Sehingga kami sempat sampaikan pada teman-teman semuanya di Purworejo akan kami coba untuk menginisiasi 1 desa, 1 village, satu alat bantu minimal. Kalau itu benar-benar bisa kami lakukan, merupakan kekuatan yang cukup besar. Ingat, di kabupaten kami ada 494 desa kelurahan. Kalau semuanya bergerak, kami optimis akan lebih cepat kami mampu melayani seluruh alat bantu yang dibutuhkan oleh saudara-saudara kami penyandang disabilitas. Terima kasih kami juga sampaikan pada Komite Disabilitas Nasional, Bang Jona, kemudian dari Kementerian PMK, sudah memberikan support yang luar biasa, Kementerian Kesehatan, juga Kementerian apa yang kemarin saya catat itu ada beberapa ya. Kemudian dari pemerintah Provinsi Jawa Tengah, khususnya Dinas Sosial Provinsi Jawa Tengah, juga memberikan apresiasi yang luar biasa. Kami diberi kesempatan untuk menularkan sistem ini kepada pemerintah kabupaten kota lain di tingkat Jawa Tengah. Dan beberapa teman kami di kabupaten kota lain juga alhamdulillah memberikan respek yang sangat bagus dan ada niat untuk mereplikasi sistem ini. Kira-kira itu yang dapat kami sampaikan, Mas Adit. Terima kasih pada supportnya YAKKUM, HelpAge, Assistive, UNOPS, dan seluruh komunitas, kementerian maupun lembaga. Kami mohon kerjasama dalam hal yang lain mungkin bisa dilanjutkan supaya sistem yang kami bangun ini menjadi semakin matang, semakin baik, dan tentu akan semakin mampu melayani kebutuhan alat bantu yang adaptif pada saudara-saudara kita penyandang disabilitas dan lanjut usia. Di Kabupaten Purworejo tidak hanya disabilitas saja, tapi juga bisa menjangkau saudara-saudara kita yang lansia yang kemudian menjadi penyandang disabilitas. Thank you, terima kasih. Assalamualaikum warahmatullahi wabarakatuh.
I think that, so I wanted to say something about the AI translation first. Those of you that were using the pop-out browser got a pretty good translation. And I think some of you, if you were using the Zoom app, did not. But we'll send out the transcript when we send out the recording. So if you missed it, we'll do that for you. And I wanted to say, I think that one thing that's really useful about hearing from you is what we see in so many countries with decentralization of systems and services and budgets and how policy is developed. So it's really useful to hear from the district about what has been useful. And then I'd like to please welcome Jonah Aman Dominique, who is the commissioner from the National Disability Commission, the Commissie Nacional Disability, to come and share with us your perspective from the national level. Thank you.
Terima kasih yang kami hormati semua tim dari HelpAge, UNOP, dan yang kami hormati tim manajemen dari YAKKUM, teman-teman Purworejo, dan negara-negara sahabat yang hadir pada webinar kita pada malam hari ini. Perkenalkan, saya Jonah Damanik, saya buta, saya salah seorang komisioner dari 7 orang komisioner yang ada di Komisi Nasional Disabilitas Indonesia. Kami dimandatkan untuk melakukan pemantauan, monitoring, evaluasi, dan advokasi atas penghormatan, pelindungan, dan pemenuhan hak penyandang disabilitas di Indonesia. Kami lembaga human right, lembaga hak asasi manusia yang independen, non-struktural, dan bertanggung jawab langsung pada Presiden. Kami ber-MOU, mempunyai nota kesepahaman dengan YAKKUM dalam rangka penghormatan, pelindungan, dan pemenuhan hak penyandang disabilitas sesuai tugas fungsi masing-masing. Nah, terkait dengan apa yang sudah dilakukan oleh YAKKUM menyangkut assistive technology, ya, tentu sangat kami apresiasi praktek baik di Purworejo yang kemudian di scaling up ke level provinsi di Jawa Tengah, ya. Dan ini menjadi inspirasi sekaligus menjadi literasi dan bahan advokasi kami, Komisi Nasional Disabilitas, untuk memperluas praktek-praktek baik advokasi, membangun sistem pemenuhan alat bantu di level distrik maupun provinsi ke level nasional. Saat ini kami sedang still ongoing bersama dengan Kementerian Pembangunan Manusia dan Kebudayaan, ya, dalam rangka memulai drafting peta jalan pemenuhan alat bantu di Indonesia, itu pertama. Terus yang kedua adalah menghidupkan kembali technical working group atau semacam kelompok kerja pemenuhan alat bantu di level nasional. Dan yang ketiga, bagaimana mengintegrasikan peta jalan pemenuhan alat bantu di level nasional dengan peta jalan layanan kesehatan yang inklusif disabilitas yang sedang disusun regulasinya atau kebijakannya di level nasional. Nah, Bapak Ibu, satu hal yang kami sangat terbantu dengan kerja-kerja teman-teman YAKKUM di Purworejo maupun di provinsi, yang paling sulit adalah merubah perspektif. Dan itu berhasil dilakukan oleh teman-teman YAKKUM. Merubah perspektif ketika berbicara urusan penyandang disabilitas adalah urusan dinas sosial, urusan Pak J. Tetapi ternyata di Purworejo itu menjadi urusan banyak pihak, multi-stakeholder duty, multi-stakeholder mandatory. Dan kelompok kerja yang ada di Purworejo yang multi-stakeholder itu dibekali dengan kebijakan. Ini penting. Kalau multi stakeholder dalam kelompok kerja itu tidak dibekali kebijakan berupa SK Bupati atau peraturan daerah, nothing. Karena Indonesia culture-nya dibangun dari sebuah kebijakan ke kebijakan berikutnya, baik di level nasional sampai ke level desa. Ini poin penting. Kelompok kerja yang ada di Purworejo dibekali dengan mandat kebijakan. Ini yang menginspirasi, ini yang membuat motivasi di level nasional. Kami yang keempat sedang berusaha mengadvokasi lahirnya kebijakan Menteri Koordinator Pemberdayaan Manusia dan Kebudayaan dalam rangka bagaimana kelompok kerja, bagaimana peta jalan itu mendapat kebijakan, mendapat endorse. Karena itu akan berelasi dengan sistem koordinasi, akan berelasi dengan mekanisme anggaran, dengan mekanisme program di level nasional. Perspektif itu yang betul-betul terbukti di Purworejo. Jadi ini bukan urusan dinas sosial saja, tapi multi stakeholder. Ini poin-poin paling dasar yang kami rasakan betul-betul memotivasi dan menginspirasi. Dan itu bisa dibuktikan, kita sudah beberapa kali diseminasi di level nasional, kami menginisiasi juga multi stakeholder meeting, dan itu kita bisa buktikan, bahkan beberapa kementerian sudah pergi ke Purworejo. Bahkan beberapa daerah sudah coba melakukan studi komparasi ke Purworejo. Indonesia sangat luas. Ada 504 kabupaten kota, 38 provinsi. Dan itu nggak mudah. Ya. Merubah perspektif urusan penyandang disabilitas, urusan dinas sosial, itu nggak mudah. Tetapi Purworejo bisa membuktikan itu. Nah, itu praktek baik pertama. Terus yang kedua, terkait mekanisme anggaran. Tadi Pak J katakan, kami sedang still advokasi sampai ke 400 sekian desa. Ini pun menjadi inspirasi bagi di Kementerian Desa di level nasional. Bahkan jika nanti Purworejo berhasil mengadvokasi itu, 400 sekian desa, kelurahan, memberikan satu alat bantu, minimal 1 tahun, anggaran desanya untuk penyandang disabilitas dan lansia, kami berjanji akan mengadvokasi di level nasional, akan declare. Kementerian Desa akan declare 80,000 villages in Indonesia have the same program. 180 1 year for person with disability. We still wait the best practical from Purworejo according the villages program.
Thank you.
And the notice right now, how about the exit strategy of program? Tadi Pak J katakan, kami masih still ongoing. Artinya apa? Sistem monitoring evaluasi, kami sangat sarankan, mohon dapat terus disupport oleh HelpAge UNOV dan HelpAge dalam konteks praktek baik yang ada di Indonesia. Karena apa? This is still 1 year program. But you can imagine how the output and outcome, how the impact. But we see Indonesia geographic, demographic, also the challenging. Yeah, we hopefully, yeah. Next, you can also support how to exit strategy about this program.
Yeah.
And the second one, how YAKKUM also support us. Yeah. National Disability Commission to still advocate in national level. Mungkin itu yang bisa saya sampaikan pada malam hari ini. Terima kasih banyak teman-teman YAKKUM untuk praktek baiknya. Ya, terima kasih untuk manajemen YAKKUM yang selalu mensupport. Kami Komisi Nasional Disabilitas sesuai tugas fungsi kami. Kami bukan lembaga implementator, tetapi kami butuh mitra-mitra kerja seperti YAKKUM yang disupport oleh HelpAge dan mungkin potensial-potensial program lainnya dari global. Mungkin itu saja. Terima kasih banyak. Sukses buat kita semua.
That's really quite inspirational to hear you speak about how you think that this, small project might be able to build forward. And I know that AT-Scale and Government of Indonesia have a project coming up. So I think YAKKUM will also be somehow engaged in that. But we've gone over time a bit. I really appreciate all of the interventions. I hope others have found it useful. I'm sorry about the AI translation glitch. We'll send out transcripts as well to make it easier for you afterwards. Shall I hand over to you, Satish, for closing comments, or Anil from AT-Scale?
I can do that. So thank you very much for those informative interventions, both from Indonesia and Tanzania. From AT-Scale perspective, UNOPS and USAID perspective, I mean, these are significant milestones in advancing assistive technology access in Indonesia and Tanzania. And it very well resonates with AT-Scale aim and mission to ensure that all people who need assistive technology do access them. I also liked and something which Diana also mentioned is the country-specific approaches, where in Indonesia it was more bottom-up approach, collaborating with grassroots and then trying to build it up at the national level, whereas in Tanzania it was more top-down approach to ensure high-level political commitments. For me, I think the key highlights, and we should be really proud about the achievements which happen in both the countries. I've worked all my life working on policy issues, and they are never easy. They are never easy to generate that political willingness, momentum on a specific topic like assistive technology, which we all know most of the time is not at the high priority list of the governments. And in light of all those background, the work which has happened in Tanzania and Indonesia to build the awareness, to build political momentum, to get different stakeholders together and speak about and discuss the challenges of assistive technology and how that can be addressed. These are significant achievements. We also saw, for example, related with stakeholder engagement, one of the speaker from Indonesia did mention about the technical working group which was established, and then a decree for continuation of that technical working group. These are huge work which has happened. Both these programs also highlighted the importance of empowering the community and engaging the community and the government together. In Indonesia, we saw how the bottom-up approach empowered the local governments, local communities to voice their needs, and the local governments to contribute in developing the assistive technology strategies, ensuring that solutions and strategies and policy work which happens at national level are relevant for grassroots and are relevant at the local level. We also see both the work happening in Indonesia and Tanzania led to high-level advocacy. For example, the Tanzania top-down approach facilitated high-level advocacy, leading to stronger government support and integration of assistive technology into national health and social welfare agendas. In both my visit to Tanzania and Indonesia, the efforts done by HelpAge was mentioned. The government was extremely first of all, the government were very sensitized on the topic of assistive technology, which we highly attribute to the work happening from HelpAge in collaboration with various stakeholders in those two countries. And it was quite enriching, and it was to see that these efforts has made an impact, something which the commissioner in Indonesia also spoke about. For us, I think the capacity building was also a very important component in both the country programs, and how those capacity building were done at various levels, enhancing the local stakeholders' ability to continue advocating on the importance of assistive technology. All this work and done by HelpAge in collaboration with stakeholders at the country level, and leading to government engagement on the topic of assistive technology. All these efforts has not gone unnoticed. As mentioned a few times, there will be scale-up support or longer. When I say scale-up, I mean a longer-term support, a relatively longer-term support with more in-depth investments. So, for example, Tanzania will be supported through a $3 million grant to scale up access to vision and hearing services for school-age children. Indonesia will be supported through a grant of $6 million, which includes provision of vision, hearing, and mobility services for school-age children. And both grants for Indonesia and Tanzania, we hope that the programs will be fully operational by end of this year. Right now, we are in the process of identifying the implementing partners for both the countries. So the work done by HelpAge, the work done by the country stakeholders, all has led to this significant achievement of additional investment in both those two countries. I want to end up by expressing my huge gratitude to HelpAge, as well as all the partners, the government ministries, agencies, stakeholders, civil society, community members who has been involved in this program in both the countries, in Indonesia and Tanzania. And AT Scale is committed and remains committed to support the ongoing efforts to improve the lives of people through life-changing assistive technology for people who need them in both those countries. So thank you very much for this opportunity to listen. I highly recommend that. The session today focused on what happened in the countries. And I think what will be relevant is also to work probably on a paper or a journal paper or something of that like, which explains more in detail on what happened behind to make it where we are in those two countries, which can be also a huge learning piece for other countries who are embarking on a similar journey. So thank you very much for this opportunity, and back to you, Katalin. Thank you.
Thank you. I think you summarized quite well, and I don't need to do any more summary, but I know that we are a bit over time. So I'll just thank everyone for joining us and promise to share out the slides and the recording and transcripts. And also, if you do have any questions, type them in the chat and we'll send out answers to your Q&A along with all of that, because we ran over for our presenting time, so we didn't have a chance to take as many questions as we had hoped to. Thank you all for joining us. I hope you have a good rest of your day or evening, depending on which time zone you're in, and look forward to working in the future together on this issue, a very important issue of universal access to AT. Thank you.